Hey, welcome to the Elle Russ Show. My name is Elle Russ, and I am a #1 best-selling author and master coach. My intention is to inspire, educate, and motivate you with weekly content featuring amazing guests and solo episodes. Visit my website, elleruss.com, to learn more about me, my courses, free masterclasses, partner discounts, and much more. Enjoy the show. Lauren Lewis, welcome to the show. How are you?
I'm great. Thank you for having me.
So, I'm so happy with the advent over past like 15, 20 years with family nurse practitioners, and being such a wonderful addition to doctors and in general, just to the population. We need more of you. And we're going to get into your work with Dr. Corey Reiser, who I have interviewed and spoken with many times, and I love what you guys are doing. But before we get into, your outfit and what you're doing specifically with FHC, let's talk about what was your journey to become a nurse practitioner? Why the decision to go into this?
Yeah, I actually have a degree. My first degree was in exercise physiology, and I really liked studying how the body moved and what made it most effective. And I was initially going to be a physical therapist, decided that that was not the route I wanted to go, and went back into nursing after doing personal training for a long time. And as a nurse, I think the natural progression was to do a family or be a nurse practitioner, family nurse practitioner. But my experience, I was able to work in a hospital setting. And the most influential site I was at Duke University. And they really took a holistic approach, even the doctors in the hospital, to the patient care. I mean, you were involved as a nurse and the doctor and the medical assistant. Everyone was involved in that patient care and everyone was on the same page. And it really had an impact on the way I looked at medicine. So when I became a nurse practitioner, I went into orthopedics, but into regenerative medicine and orthopedics. And instead of just throwing a steroid or a pain medication at someone, we took a more natural approach. So using the own body's natural healing sources to rejuvenate orthopedic issues. And I think when I met Dr. Reiser, just organically transitioned into this role where we were like, hey, direct primary care it's new and it's upcoming, but the most important thing about it is it's beneficial for the patient and the provider alike. And being able to work with him in the functional medicine practice and give our patients better access to primary care it's my niche. It's where I want to be. It's what I want to speak about. And I really hope that everybody sees the benefit of it.
Well, and let's define it. What is direct primary care? I mean, it's an alternative model. And then I guess on the heels of that, add, okay, well, why would I pay for direct primary care if like I have insurance? By the way, I could just answer that for myself right now because the doctor down the street that comes with my insurance is obese and a fucking moron. Sorry, I'm going to say it. I'm going to say it, right? So
right.
Now look, she maybe has, I'm going to feel like she could be struggling with something. I'm not going to blame her for not knowing what's up. I'm just saying, she's kind of like the dum-dums down the street. I don't really have a choice. There's not really a lot of great other situations, but I'm also not going to go to her to have a like in-depth discussion about my true health. I'm going to go to her to get lab and a pap smear and blah, blah, blah. And I'm gone. Right. So anyway, back to direct primary care and why pay for that when I have insurance, if I didn't already answer that.
Well, I mean, to speak to that a little bit, right? You have to trust the person that's in front of you. And that's what this is. And that's what healthcare should be. But unfortunately, in an insurance driven world, we as providers are not allowed to spend that time with you. We're not allowed to do what's best for you. We are driven by what insurance tells us we have to do. And that's where this takes insurance out of that, out of the process. And it allows us to actually treat the root of the problem, listen to you, spend as much time as we need with you to really get down to the nitty gritty of like, what's going on here?
And test you, right? I want to jump in and say the testing specifically, because even if you went into that doctor and the primary, the person your insurance dum-dums down the street, and they like you said, even if they're not a dum-dums, they have only 15 minutes. They are
Mhm.
dictated by insurance, and they are not going to check reverse T3 as a test for you because they're going to be like, no, 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 it's unnecessary. Because again, they've got some conglomerate situation over them hovering where they have to like think about it twice.
Exactly, exactly,
Right.
exactly. They're not going to run those tests. And then what's going to happen? I think this happened with you, Elle, right? They're going to put you on a medication that doesn't do anything for you. And then what I see with patients is they go years and years and years of feeling like crap until finally someone says, have we checked a reverse T3, right? And that is the patients that I've seen recently are these we do intake questionnaires before you come into our practice. And the questionnaire, one of the questions say, when was the last time you really felt well? And it is astounding. It breaks my heart. It's 4 years, 6 years, 8 years, 20 years.
Mm.
And it's inattention. I mean, you could almost call it neglect, but think about it. I mean, like you just said, the providers are driven by the insurance companies to do this. We're billing you every second that you sit in there. And so that's what direct primary care does. It's a low monthly fee membership, and you get unlimited access to us. We get your labs for at cost because your insurance also drives up the cost of your labs. You get free visits. A lot of your labs we can cover under your membership, and you don't have to pay for them. And your procedures are at cost too, because we're not asking insurance to tell us how much we think these procedures should be. So that's the benefit of that, where you're not having to bill your insurance every single time you come in or every single time you get a lab or procedure, et cetera.
And the doctor that's working in the insurance is going to literally balk at your request for like, hey, can you test like vitamin D or B12?
Yeah,
Like they
absolutely.
will, they'll be like, that's not necessary. Like they will just scoff it off because it's like they don't have the time. They're not gonna, you know what I mean? And I remember I was at a pharmacy recently and I prefer a certain liothyronine sodium, a certain T3 from a certain
Mhm.
pharmaceutical company versus another one. Like I've just noticed like one company has chalky weird pills and I don't think it's as good. So whatever, for whatever reason, right? I just like, and most of the time the branches are really great about ordering it from there. I'll say, hey, I'd like it from, it's Greenstone LLC. I'm like, hey, I'd like it from Greenstone. And they're like, all right, great, thanks, whatever. Well, this one guy at a pharmacist was like, you know what? I don't like you get what you get. Like, I don't have time. I'm like, no, 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 no. You're working for me. I'm sorry. This is I'm like, what?
Mhm.
Because so many people get patronized also along the way, even by a pharmacist who's not willing. Now, listen, I'll go somewhere else to another pharmacy that's willing to order it. But like he was just so discounting. And you're
Mhm.
like, no, actually, that's not how this works. Like, you know what I mean? Like your neighbor's doing it at the other branch, and so is the other neighbor. Like, you can do it too. Don't tell me you don't have the capabilities. So a lot of people get patronized. That's a pharmacy example, but it's happened many times with doctors, and it's about certain tests that people want to request, and you don't have that problem here, and that's why it's worth it because you end up actually really paying more in the long run by continually going to doctor after doctor and realizing, you're not getting what you need. And then of course, that's why you get the people they're like, I've been suffering for 6 years and saw 500 people and now
Mhm.
they're with you. And
Absolutely.
that's what I love about your outfit too. It's more than just one. There are so many modalities and things available for looking and assessing and truly looking at the whole person, which is what functional medicine is. Talk about functional medicine and why you as a nurse practitioner um, are geeked out on that.
Well, I mean, and go back to the pharmacist, this kind of ties in with this, but it's health care, right? We're supposed to be caring for people. And the system, sometimes it's not always the provider's fault. The system just doesn't allow you to do so. And I like functional medicine. I run the primary care portion of our clinic. Dr. Reiser and Dr. Mark are much more well versed in the actual functional medicine side of it. But the idea behind it and what I love about it is you're treating the root of the problem instead of just slapping a medication on it or telling a person to lose weight. I There are so many examples of patients that come in because we do spend so much time with them and go over their goals and go over realistic expectations and things like that. And there's so many examples of these patients that go in to see their primary care or their specialist, and the specialist says, oh, well, you wouldn't have this problem if you just lost weight. Just go lose weight, right?
Yep.
Well, help me, right? You can't just tell me to diet and exercise. Like maybe I have something in my gut that's not responding well. Maybe my thyroid is inactive for reasons that a thyroid test doesn't show. And so that's what I love about functional medicine. And I've become so passionate about it. And I think a lot of direct primary cares are standalone. And I would really encourage people that are starting a direct primary care practice to either join forces with functional medicine or learn about functional medicine and implement that into your practice, because you do have the time. You have the time to sit with the patient, to do these tests, to really get to the root of the problem. And then that leads to the person not having to come back year after year after year saying, I'm still not feeling good. And that's what we're supposed to do in healthcare. It's healthcare. We're supposed to care about the people that are in front of us and do everything we can to make them better.
Let's talk about some of the success stories and the 180s of people you've worked with, no matter what the condition, from the most dire to something that, like, oh, who knew, right? Everyone thought it was that, but it turned out it was this. And it was really simple. Sometimes, like I've seen a lot of times coaching throughout the years, honestly, sometimes it's a real simple, dumb fix, like a bottle of iron. You know what I mean?
Right.
And they've been
Right.
suffering forever. And you're like, actually, I think the problem's real simple here. I mean, there have been several cases of that where, or it's like, actually, I don't have a thyroid problem, but, maybe you just need to remove that or maybe look into that. And so sometimes it really is a simple fix. And then, of course, you want people like you and the functional health care of North functional care. What is it? Sorry, functional FHC Carolinas.
Health care of the Carolinas. It's
because there's two C's on the end. It's like functional health care of the Carolinas.
Yeah.
But that's what I like as well too, because if someone had like Lyme disease and EBV flares and menopause and a thyroid problem, trust me, my doctor down the street. It's funny. I'm going to go to my insurance doctor down the street just for the like blood work and the whatever in a couple of weeks, and I'm gonna tell her, like, here I'm taking like testosterone, progesterone, I'm in perimenopause. I'm curious to see what she's gonna say. I'm like wondering if she's gonna be like, what are you doing? I'm just curious to see if she would even, I don't know. I think like a doctor like her would never prescribe that.
Right. And that's what I learned in regenerative medicine is when you're trained, and I was trained in Western medicine, when you're trained in that and that's all that's what you prescribe. That's how you treat your patients. But I think we have a responsibility as providers to dig deeper, right? Everything is not black and white. Everything is not a Synthroid or a metoprolol or a metformin. I mean, there are some things that if you just throw those medications at people, they won't get better and they'll actually be sicker because you're going to create new problems that they didn't have before, because that's not what their body needs. I had a patient that recently came in and had her first episode of what she thought was AFib, right? She had a fluttery heart. She had gone to the urgent care. They had done this entire workup on her. They were telling her they needed to cardiovert her. And the language they were using, they're like, we're going to put you in a coma. We're going to shock your heart. I mean, to me, these things don't sound scary because I'm in the medical field, but this woman had no idea anything was wrong with her heart.
Oh, yeah, that's scary.
Yeah. She said they were playing Slipknot, some Slipknot song, like "You Will Die" in the waiting room. And she said she just ran out of there. I mean, these are like genuine fears of people. And so when she came into the office and she had all these diagnoses and everything, first and foremost, I want to keep people safe. Like if you are in a flutter, that is a potential emergency and you do need a cardiac workup. But they didn't check her thyroid. They didn't check, just basic things that all they were focused on was one little thing. And long story short, we've checked her thyroid. She has Hashimoto's. Thyroid issues can cause heart palpitations, but they wanted to do three or four very extensive, very invasive procedures. They put her on three different heart medications. She felt like crap for 2 weeks. She also, not to mention just she felt like crap, but emotionally, mentally, she was crying in my office. She was saying, Lauren, I've done everything I could do to take care of myself. My mom had all these heart issues. I don't eat gluten. I have a good diet. I exercise. I do all these things. Why is this happening to me? Right. And that's what I don't think that in regular primary care, we get the attention, we give that attention to is people's emotional needs. Like physical health weighs emotionally on people. And that's a huge component of mental health and where we are today in this day and age anyway, is we don't pay enough attention to that. But long story short, we figured out the thyroid issue. We sent her to a different cardiologist for a second opinion. No invasive procedure necessary. Took all of her off all of her medications, and end of the day, clean bill of health. Right? We just needed to address the thyroid. And I mean, can you imagine this woman would have been on 3 different medications? She would have gone under risky procedures, all because somebody didn't take the time to just look at the whole picture.
And I want to chime in there and say, yeah, people's organs have been removed because of this. You know what I'm saying? Because they're not looking at the thyroid. So then someone's like, well, I have all these, like fibroid tumors in my uterus. And then they take they're like, oh, you need hysterectomy. Like, oh my God, everybody, you guys, second, third opinions, please. First of all.
Sure.
But yeah, that's the case too. A lot of times when the Western people, like you said, the cardiologist, I mean, I had a friend who randomly, he had gone to his doctor. His doctor's like, I'm worried about your cholesterol labs, which were not worrisome if you and I were looking at it. Okay. So then they sent him to a cardiologist at UCLA, Cedar Sinai, like best cardiologist in LA. And the guy's like, you're gonna need a statin, and by the way, my friend had been told this on and off throughout his life. So he was walking around in a fear always about like his cholesterol, because he's already been told like, oof, I don't know, by this dumb doctor who evaluated it wrong. Right. So he has the statin, he got the prescription, he has it in his car, and he happened to turn on my podcast that day. And it was with Dr. Forsman all about CAD screenings and statins. And it was it was perfect timing. And he heard it and he was like, oh my God. So I, sent him, I was like, listen, just go talk to Dr. Forsman. He said, fine. So they sent him for a CAD screening. They do all the stuff. Perfect. Everything's perfect. And the thing about that sucks is that he had a story projected onto him about this fear. Like, I'm sure every time he was eating some fatty stuff, he used some meat or fat, meat off of a steak, he thought, but turns out he's got free reign to go enjoy his life because everything's perfect. And yet he was made to be worried for it was 10, 15 years of his life. He's like 55 now. He's in perfect health. And it just changed his whole life to finally get this like, oh my God. And by the way, his initial doctor went to Harvard. Okay, everyone. I just wanted to share with everyone that don't be impressed by that. But that's a classic example, sort of like yours.
Yeah.
They're just focusing on one thing and they're focusing on it in the wrong way. They're not looking at the master gland, the thyroid. We need T3 for our heart to work properly. I noticed the difference because I've done so many experiments myself over the years with like thyroid hormone replacement that, there are times when you can have if you're super hypothyroid, you can have really, really, really low pulse. Mm-hmm. And then it also can be extra high resting pulse. It's like your heart has to work harder in the absence of T3. And in those moments, then when I'd be hypo and then got on medication, I would notice the heart rate would go down.
Right.
Because my heart was getting what it needed. So anyway, just wanted to chime in on that thyroid aspect being important to heart, because you mentioned that example. But I would that's a wonderful, perfect story too, of someone who I'm doing everything, and they just need help. Yeah.
Yeah. The guy that you were just referring to, can you imagine the emotional toll that takes on someone for 15 years being scared every time he cut into a steak that he was just going to stroke out? I mean, what does that do to your cortisol levels and your body? All of that stress. We're already stressed out enough. And
he went to the doctor a lot, by the way, as a result of it. He would go I remember he'd go get his cholesterol checked 3 times a year. And I think probably because he thought he was skating on thin ice and he was probably worried about some of these indulgences. Turns out he never needed to at all.
Right.
Yeah,
And
but you're right. It's
we're
an
all
emotional
human.
toll because it's
Yeah.
like feeling like you've been stamped like something is wrong with you
Yeah,
that never was.
exactly. And you have to remember, like, providers are humans, right? We're all
Yes.
humans. We make errors in our job just like everyone else does. But I think to your point of that doctor went to Harvard, your doctor is a dum-dum obese. I'm going to start using dum-dum insurance and provider now. Um, but to that point, do you trust your provider? When you sit in front of your provider, do you get a bad feeling? Do you feel like your best interest is not in mind? Do you feel like they're rushing you through the appointment? It's time to switch, right? You're not going to go to a hairdresser that screws up your hair every time. And you're not going to go keep taking your child to a daycare where you don't think they treat them right. So make your health your priority and go somewhere where people are going to listen to you, because this is the only body that you get. So go to someone that you trust, that you say, okay, things are heading in the right direction, and stick with that provider. You're not going to offend the primary care doctor that you've been with for 30 years that's not helping you anymore, right? There's no point in staying with that person if you don't trust them.
Let's be honest, their ego is so big. They're not gonna, you're
They don't
not
care.
gonna.
They don't care. I'll go home and cry at night if you leave
That's
me.
right, but they don't.
But yeah, you've got to do what's best for you, just like you do in all those situations.
Yeah, tell us a few others that you've encountered, of some stories of people who've come in and some of the success that they've had with functional practicing.
Yeah, I think specifically one patient, we see a lot of the same things. We see a lot of thyroid, we see a lot of gut issues, we see a lot of uncontrolled diabetes, and we see, like I said, just in general, people not feeling really well. And we do a lot of gut testing, and that is definitely not done in primary care. Your gut is so important. I just listened to, I don't know if you listen to Ed Milet, but I just listened to a podcast on how when you're formed in the womb, how closely connected your brain and your gut are, and how our gut produces a lot of serotonin, and people actually don't know that. So
Mhm.
people that have a lot of anxiety or depression, my first thought is, let's look at the gut. Okay,
Yeah,
so
Dr. Perlmutter would say that in Brain
oh,
Drain and Brain Maker. Absolutely. There
100%.
was that when we interviewed him on the Primal Blueprint podcast back in the day, he talked about a study that he did that was out of his book where, they took some kids that were being adopted from, I don't know, they were like teens coming here for college, but they were from like Nigeria or some coastal town where they had a certain, like, very basic, obviously sort of clean primalish diet.
Mhm.
And then they came here and became very depressed. And
Ooh,
they looked at the diet and it was like all of the junk you get in the US, all the junk we have
absolutely.
available to them. And I forget exactly what that study was, but he talks about that. Yes. And that is why, um, as one of the first primal health coaches out there, but in general, the idea of ancestral paleo primal whole food living, getting back to those roots is so about people do it to help their patients in the mental health field.
Absolutely. Everything from the ground. I mean, the more you can eat from the earth and from the ground, the better. It has good bacteria in it. That's one of the things that we look at in the gut is, people in Western medicine are so quick to have antibiotics thrown at them. I mean, it just strips your gut. It strips your body of this positive bacteria that does really good things. And similar to that study, there was a study of, think about how we all evolved, right? We used to live more rurally. I can never say that word. We used to live in rural areas, and everything was from the ground, and then you move into bigger cities and people are getting sick and people are dying, and it's not just the congestion of the cities, it's the lack of bacteria, right? Food is processed differently. And so I had this one patient, for instance, that been seen by multiple doctors, came in, she depressed, thinks she has leaky gut. No primary care doctor will diagnose her with leaky gut. Nobody would even do a test, like a GI map on her. And she comes in and she's scared she has parasites. And so again, what we're doing is just calming the fears first. But come to find out, she's got some strains of bacteria in her gut. But if you kill that good bacteria, you're also killing the bad bacteria. So in functional medicine, instead of just throwing an antibiotic at it, what are we doing? We're going to promote the growth of the good bacteria to overpower the bad bacteria. And I just like that approach much better because, like you just said, that's so much more natural. That's the way we always used to do it. The food that we ate, the environment that we were in, that our body, our gut needs to be acidic. It needs to have bacteria in it so that it can process and digest and take our food where it needs to go. But most importantly, keep producing the chemicals that keep us going, keep us happy, such as serotonin.
You know, it's just thinking about antibiotics, because it happened to me recently. I so many, many years ago, like I'll never get waxed again because I always get ingrown hair. Like I was just like, nope, just gonna have to do it myself because I get ingrown hair. So years ago, I had a situation where I went into a dermatologist. I'm like, I don't know what happened. I got waxed the first time. This is a disaster. Like, and they were like, prescribe me some like strong antibiotic.
Yeah.
And I was like, what? Like nothing was infected. There was no staph infection. Like it wasn't, you know what I mean? It was just like ingrown hairs. Like, okay,
Mm-hmm.
like, or, I'm like, or it's like, or you could just like put this on, it'll go away. Like, all
Mm-hmm.
right, well, all right. So you want to just throw an antibiotic at me. And then recently it happened. So that was like, I don't know, 15 years ago. And then recently it happened where I had an ingrown hair and I thought, oh, you know what? I don't want this to get out of control because if it became a boil or, it was kind of heading in that direction, it was like, uh-oh, this is a problem. So I like went into a med spa to be like, hey, just inject it with a little bit of cortisone. Right. And so, versus, hey, you need an antibiotic for that as well,
Mm-hmm.
instead of, and I did still call my non-dum-dum, my functional doctor, the smart one. And I was like, hey, look, just want to review this though, because nothing's tender, nothing's crazy. There's no fever, there's no infection. It's just like this thing looked like it might get out of control here from this ingrown hair. And I just wanted to nip it in the bud. So I got a shot with cortisone. Do I need antibiotics? He's like, no, just go like put some topical silver on it and like call it a day. And if it gets bad, call me. But no, you don't need antibiotic. Like, you know what I mean?
Right.
It's
Your
like,
body is the antibiotic.
yeah. And I'm like, all right. So I took some oregano oil and like got the thing shot up. And by the way, it was the right thing to do. It absolutely worked having me go in and do that. And that's where Western medicine, thank God for the little cortisone shot in there. I did need that, but I didn't need to go to another level then and
Right.
put an antibiotic into my body, and so many people are just willing to jump at like, oh, here's all the kitchen sink things. And you're like, well,
Mhm.
can we maybe just choose one ingredient to start and see what happens there? Or is there another
Exactly.
option? Because my doctor, if he felt that way, would absolutely say, get your ass to the pharmacy and go to the hospital. I mean, if he felt that was, do you know what I
Hmm.
mean? The situation. So they're just over prescribed.
Yeah, absolutely. And you bring up a good point. I mean, I am not an antibiotic basher, steroid basher, surgery basher. There's a time and place for
Yep.
that, but it's what is the right time and place, right?
Mhm.
And like you just said, you can cause more complications by over medicating somebody, over prescribing something they don't need, and then their body reacts negatively to it then or in the future. And so it's what what fits in this puzzle piece today. And I don't think that's what you get when you go to see your doctor anymore. You don't get that time to actually, I mean, it's critical thinking, right? We have to sit down. That's why we call
Yes.
it practicing medicine, because we have to sit down and critically think about all the parts that make up this puzzle. And if you don't have the time to do that, then you're not going to get there. So that's what I do want to tell everybody out there. If you need to go to the emergency room, if you need an antibiotic, like you might need those at some point in your
Yeah.
life.
They've
Um,
saved my life. They have absolutely
yeah,
saved my life before. I cannot deny
absolutely.
it. Yeah.
Absolutely. So, but I do think people want this. I think with the internet, you can research anything these days. And I think people are more interested now in taking control of their health and seeing what other options are out there instead of more invasive and harsher things that they know can disrupt their body's homeostasis. Oh, did I lose you?
Oh, sorry. Sorry there. I was discussing something and realized I'd hit the mute button. Um, I was saying diabetes, when you were mentioning that that's like a large, a lot of people coming with type 2 diabetes issues,
Mhm.
pre-diabetic stuff. Um, Everyone listening, if you have a concerning HbA1c, if you're pre-diabetic or you have entered into the realm, please please talk to Lauren. Please go see someone who's a functional
Please.
practitioner, because all your dum dum down the street, my dum dum down the street, who's obese, by the way, she probably has type 2 diabetes. But if she would just be like, oh, well, here's a pill and we'll watch it in 6 months. They are not going to give you the solution. And the solution is there for everybody. It's called low carb, healthy living slash even maybe keto. There are some medical interventions that might be necessary at first and then could be weaned off. It is an absolutely fixable problem. It's
It is.
fixable. Um, I have seen, I had a friend's father who lost like 3 toes to type 2 diabetes, and you say, be like, okay, 3 toes at the same time? No, went back 3 times because again the addiction was brutal, but every time they got him on keto, they had him going, the blood sugar was great, he was feeling great, he'd be going for a while, then the addiction would come back somehow and he would fall off the wagon and now lose another toe, and then he'd go back, so he'd fix it and then go back. I mean, it was
Right.
like unbelievable to see it, but it's really, there is a solution to this. And the solution is not to go on insulin if you don't have to. And a lot of people don't, if you do it right, with a practitioner, you don't have to go on insulin. And people just feel so lost about it because the conventional doctors really are not going to give you the real, just very easy lifestyle solution because they never learned it. Some do now, some are catching on. But so anyway, I just want to throw that out there to anyone listening. Like, that's a solvable thing.
Yeah, it really is. It's one of the few diseases that is absolutely reversible, right?
Yep.
So the difference between type 1 and type 2 is something that happens typically later in life. It's diet, it's exercise, it's your body really just putting a hitting on your pancreas. And again, it's not a one size fits all, right? It's not a, you need to do, everyone can do the exact same thing, everyone can do the exact same diet. But that's the beauty of functional medicine and direct primary care, is we're going to sit down with you and figure out what fits best into your lifestyle to do those things. Yes, you do have to, change your diet habits, you do have to change your exercise habits. But there are things that are not medication, that are supplements like berberine and ALL and chromium that can really help the body process that sugar a lot better along with your lifestyle changes. And I don't know that a lot of people know that, Elle, that people literally lose limbs because of diabetes. I mean,
Oh
you
yeah.
do
Yeah.
not get perfusion to the parts of your body that need it. And think about your whole body like an organ, right? You're not getting the appropriate blood flow or the appropriate nutrients to areas of your body because of this. And so typically you're going to go to your primary care. They're going to put you on metformin if you're pre-diabetic. I strongly encourage you to come to us, talk to us. There are other things we can do besides just put you on a medication. And that includes, like I said, lifestyle changes, but there are some supplements that we can work with that can hopefully get you there.
I don't know if you've ever seen it, and I want to just tell the audience about it, because if the audience follows Dr. Peta Attia, because a lot of people do in the health space,
Mhm.
I don't know him personally. I've never interviewed him or spoken to him, but I do remember many years ago, like it's like 10 years ago, seeing his initial TED talk that sort of launched him. And it was about the fact that he was a doctor who was like, eating this 3 square meals a day and like running and like going to the gym, and like he was really fit, like fit, healthy, good looking dude.
Mhm.
And he had a person come in who had to get was about to get a leg amputated from like type 2 and diabetes. And he talked about how he was like so judgmental about it. Do you know what I mean?
Mhm.
Right? Like, oh
Mhm.
my God, just stop fucking eating, or like whatever, whatever the like
Right.
judgments were. And but then he he was pre-diabetic at the same time.
Yeah, I
Even
didn't even
so he was
know.
like, fuck. So and then he realized, obviously that was his like jizz moment where he was like, oh my God, wait, hold on a second. If I'm doing all these things I think are right and I'm a doctor, I'm like basically judging this person, thinking they're like, oh, you lazy fat slob or whatever, stop eating, whatever the thing was. And then he's like, wait, what? Hold on, I have pre-diabetic.
not me.
How is that possible? And, we've over the years, my work with, Marcus and Brad Kearns, so many athletes are pre-diabetic and they don't realize it because they're getting away with it because they look good.
Right.
They look like the pillar of the house, but then you test their blood and they're not getting away with it on the back end, are they?
Right. Right.
Because like you said earlier, hitting the pancreas, the body doesn't like it, whether, you know, type 1, your immune system tries to murder the pancreas. But when these guys are going out for their runs in the morning, they're downing like 120 grams of carbs just in one morning shake,
Yeah.
to go before their run. That's like not even the meal for the day. Right. And so you're still knocking on that door. You're still hitting it. It's going to get pissed off at you after a while and be like, stop making me continually secrete insulin. I'm going to give up on your shit. And
Yeah,
that's type 2
absolutely.
diabetes. And so, athletes again, and that's what, and again, not endorsing any of these people. I don't know them well, but I also interviewed Dr. Stephen Gundry at one point. I remember him talking about being a heart doctor and having the young fit wives, or the not young necessarily, but like the fitter wives that have been taking care of themselves and play tennis 3 times a week, and they'd bring in their older husbands and they're like, oh, he's a disaster, his heart, whatever. And he'd be like, oh yeah, well, we're testing your blood too. And inevitably like 90% of them were inflamed, like, all sorts of stuff. And they thought that they were the one, like, oh, my lazy old garbage husband. And here I am, I've been keeping myself young all these years. And he's like, but have you?
Right.
So
Yeah.
so it is another thing I always love to just point out to people, that you can never judge someone's level of health by their body. It's really like, let me see their blood work. So the next time you are envious of someone's like hot abs, maybe you don't really want to be in that body.
Yeah, you could have a deteriorating body under that six pack. So yeah,
That's
just
right. That's right. So type 2 diabetes affects everyone, even people that think are very, very fit, and especially the ones that are following like the old paradigm of carb loading.
Sure. Yeah, absolutely. And to that end, I would also say I had someone that was very, very close to me that did not regularly go to the doctor, if at all, and ended up really, really sick. And I just think that I think there's white coat syndrome, and there's people that don't make time to go to the doctor. And that's what we want to try to do, is make your relationship with your doctor better, so that you're not dreading that appointment or you're not having to put it off. Just pay the monthly membership, come in whenever you want to. Let's do your blood work once a year. Let's just see if there are things that we can get ahead of. Because like you said, you look in the mirror and you look great, but you don't know what's going on. You don't know if your heart's screaming at you, or if you have a stroke that's looming, or if your headaches are actually high blood pressure, unless you come and get them checked. And, March, we're going to do a newsletter. March is colorectal cancer awareness month. And, there's lots of things that we put in our guts now that we didn't put in our guts 20 years ago. And what happens in cancer is those cells change. And when they change, they mutate, they multiply, and that can lead to cancer. And so just come in, get checked, get screened when you need to. And hopefully what I found with our patients is they're much more comfortable with us, because we don't have a waiting room of 500 people. We're quality over quantity. We're going to see you. We're going to talk to you as long as you need to. We're going to listen to every fear that you don't think is smart to say out loud. We're going to listen to it. But please come in and just get checked once a year. That's something that's really near and dear to my heart now, is I just want everybody to live as long as they can. So come in and just have your lab work done and just talk to us.
I always will get my full lab work done, and then I'll send it to my functional doctor, and then I'll call him and be like, listen, I want to talk to you about my blood work. I haven't looked at it. Just all I need to know is, am I dying? I'm like, that's all I want to know. I just start off with that. Like, before you discuss it, we'll go through it. I need give me the conclusion. Am I dying?
We hear
He's
that
like,
a
no,
lot.
you're not. I always like, hey, just let's cut to it.
We hear that a lot.
But do you work with people remotely, telemedicine wise?
Yeah, we absolutely do. I have a patient right now that she's going to be going back to a different country in the summer, and we're going to continue doing telehealth. Apparently, the healthcare system there is it's in Puerto Rico, and it's absolutely awful. So she said, if you're sick, you have to go to the hospital, and you're sometimes waiting in the hospital 2 to 3 days to even be seen. And that's for like a cold that hasn't gone away for 3 weeks. So,
Right.
yeah, so if we can do it there, we can do it anywhere in the United States.
Great.
And I like that. I think people like that. I think people feel more comfortable sometimes when they're able to do something remotely other than changing their day and coming in. So yeah, we absolutely do that.
Such a fantastic thing you guys are doing. Everybody go visit FHCC and then carolinas.com. You can also call 704-625-2994 to find out more. Thank you so much for everything that you guys are doing, and just love to be able to share with everybody alternatives with people who can really help you get somewhere instead of continually going to insurance doctor after insurance doctor and being given a prescription or some surgery you don't need. Anything else you'd like to leave our audience with?
No, I really would like to encourage people that are already a part of our functional medicine practice to join our primary care, just because we have that continuity of care. I talk to Dr. Reiser and Dr. Mark all the time. And I just think that this is the way that healthcare is moving. It's really good for people that have really high deductibles that they'll never meet. It's making your health a priority and taking your health care into your own hands. So, but I appreciate the opportunity to talk to you, and this has been great.
Thank you so much. And for everyone else, we'll see you next week. Hey listeners, over the years, a ton of companies have approached me to collaborate, but I will only promote companies whose products I believe in and that I actually use and consume on a regular basis. So let me tell you about some of my favorite companies that I can offer you discounts for. Rep Provisions, an amazing company doing incredible things for our planet, topsoil, and animals with regenerative agriculture, and it's my #1 source for quality pasture-raised meat and chicken. Visit repprovisions.com and use code L15 for 15% off. I'm also obsessed with a company called Carnivore Crisps. They make a lean, all-natural, and delicious alternative to conventional snacking, made with just real meat and real salt. Totally addictive, and my favorite ones are the beef brisket and the ribeye. Visit carnivorecrisps.com and use code PALEO10 for 10% off. I also love and regularly use Paleo Valley products. They make amazing supplements and delicious paleo products. I use the superfood greens powder, grass-fed beef sticks, the organ complex, and their bone broth bars. I love the lemon and apple. I also use their essential C complex and more. Visit paleovalley.com/promos/Elle Russ for 15% off. I also love Primal Kitchen. They make delicious paleo-approved, gluten-free, grain-free, soy-free, and no refined sugar products, and I use them daily, from their collagen powders and sauces and marinades to their avocado and olive oil. So good, so healthy. Visit primalkitchen.com and use code L10 for 10% off. I also love paleo powder and use it almost on everything I cook. They make incredible seasoning blends, and they also have these incredible grain-free coatings that feel just like crispy breadings that you would have had prior to knowing that there's another way. So visit paleopowder.com and use code L15 for 15% off.